The last time
Alright.
we spoke, Dr. Fauci, the last time we spoke, it was a few months into the pandemic. So we're in a totally different area now.
Boy, I'll say.
All right, well, let's get right into it. You're going to leave your role leading the National Institute of Allergy and Infectious Diseases, but you said you're not retiring, right?
That is
No.
correct.
So
That
what are
is
you
correct.
doing? What are you going to do?
Well, I'm going to enter into what I would call the next phase of my career. I feel strongly that as long as I have the energy and the passion and the commitment to continue to do public service, I want to do it in a different venue than the federal government. And that is to really devote most of my effort, given the fact that I have 54 years of experience here at the NIH and 38 years of which was as director of NIAID. And I've had the opportunity and the privilege to advise 7 presidents and to lead the country in some respects through multiple emerging outbreaks, dating back from HIV to Ebola to Zika to pandemic flu and now to COVID, that I would like to, by lecturing and writing and getting involved in activities such as that, to hopefully inspire the younger generation of scientists and would-be scientists to choose a career in public service, particularly in the arena of public health and medicine. And if I do that full time, I hopefully will have an impact on what I think is very important for this country, namely the younger generation that's coming up now and that will assume leadership roles in the near future.
So it sounds like you plan on holding classes or being a teacher of some kind for the rest of your career. Is that safe to say?
Yeah, but in different venues. I mean, you could
Okay.
do that in a classroom, or you
So
can do that by
traveling around,
writing.
you think?
Yeah,
Traveling
yeah,
around? Yeah.
absolutely. Traveling around. You can do that by writing, by lecturing, perhaps even writing a book or a memoir of some sort to give people the opportunity to look in depth at what one can do in public service.
And we all know that your job during the pandemic has become more politicized than ever before over the course of your long career. Would you say that factored into it? Because that has to be exhausting for someone such as yourself, who's not necessarily a politician or a political figure, but who was thrown into the political spotlight during the pandemic. Did that have any role in you deciding to step away?
You know, Nick, actually, quite honestly, it did not. I mean, certainly it was very stressful to be thrown without any desire on my part into a real political hurricane, as it were, as this became a very politicized issue throughout the country. But that really didn't have any impact on my decision. I had been thinking about doing this for some time. I was going to announce my stepping down after the end of the Trump administration. Because remember, Nick, I've been at the NIH for 54 years, and I've been doing this with NIAID as the director for 38 years. But when that time came, this was at the time when President Biden had just been elected. And one of the first things he did upon his election was to give me a call and ask me to be his chief medical advisor, which I very gladly did. And I felt very honored to do that. I thought that was going to last a year because I really thought, as most other people did, that the COVID outbreak would be behind us after an additional year. And here we are coming to the end of the 3rd year and we're still in it. So I just felt the time had come, while I'm still energetic and have a lot of passion, that really is the time to leave. The pressure was not comfortable. The politicization is unnecessary and unfortunate, but that really didn't have any substantive impact on my decision.
Do you think your successor, whoever that may be, will be able to turn that politicization around, or maybe limit it to some degree? I mean, you're going to leave, someone else is going to take your place, so it'll be a different face in there. Do you think that that new person will be able to turn that around?
Well, it depends on what you mean by turn it around, Nick. If you're talking about politicization in the country, no individual, my successor or anybody else, is going to impact that. That's something that's deep-seated. But if you're talking about the politicization against the National Institutes of Health, as personified by me, certainly a different person here, the people who are throwing barbs and bullets and cannons at me, likely will not do it as vigorously against someone else, because I have become, for the far radical right, an enemy, which is really unfortunate, because that is unnecessary, as we're all trying to defeat the common enemy, which is the virus. And that's quite unfortunate about the politicization. So in some respects, when it comes to the attacks on an individual, certainly I can't see the person who takes my place being the object of the attacks that I have been.
So you were one of the most public faces throughout this whole thing, as you're alluding to there. You're going to get this question a lot now that you've announced you're going to step away. Can you tell us about some of the regrets you have over the course of the pandemic, especially when it first started, when the messaging seemed to be mixed? There was the message of, well, masks aren't necessarily going to help all that much. And then that was obviously turned around 180 degrees. So there was mixed messaging. Is that part of something that you would do differently? And can you walk us through some of the other things with the benefit of hindsight that you would do differently now?
Well, I think you said the magic words, Nick. With the benefit of hindsight, one of the things that I hope will be a lesson I can give to the younger generation of scientists and public health officials is that, would I have done things differently? Well, if I didn't know what I know now, and I knew what I knew back then, I probably would have done the same thing, because the science guided what we did. But what we know now tells us that the science evolved. When we were talking about the lack of necessity of wearing masks in January, it was at a time when there was a shortage of masks, and we were told by everyone, including the Surgeon General, that there was a paucity of masks and we needed to save them for the healthcare providers. There was no evidence that outside of the healthcare setting, namely in the hospital, that masks were effective. And we didn't know at the time that most, at least 50 to 60% of the transmissions were from someone who had no symptoms, and that aerosol was a very important way to transmit. We did not know that then. Had we known that then, we would have been pushing for masks very vigorously in January. However, as soon as it became clear that there were plenty of masks and that the virus was transmitted by people without symptoms, and that the masks did work, and that there was transmission through aerosol, as soon as that became clear, then I, together with many of my colleagues, very, very vigorously recommended masks, which paradoxically, the people who are criticizing us now for saying don't wear masks then are the ones that are criticizing us now because we're saying we should wear masks. Think of that, Nick.
I want to get your thought. I've heard people talk about this issue, and I've seen it myself, and I'm sure you've seen it. When individuals are in their car, for instance, alone wearing a mask, I think there might still be some misunderstanding about how much protection a mask gives you, when you should wear a mask. When you, Dr. Fauci, see someone in a car and they're alone by themselves wearing a mask, what would your message be in that situation?
Well, if I could talk to them, I would say, take your mask off. You're not protecting yourself against anything. You know,
Right.
Nick, I one of my only forms of relaxation, if you want to call it that, is that I exercise and power walk every day,
That's good.
usually with my wife. On the weekends, I do that on the C&O Canal. And when I pass people who are all alone with masks on as they're walking by, I like to say, hey, take your mask off. It's easy to run without a mask, particularly when there's nobody near you. So
Yes,
you're right. There is a bit of a misperception about what masks do. If you are in a congregate indoor setting and you are in an environment where there's a lot of viral activity, of course, particularly when you're in an orange or red zone, the way we were in the DC, Maryland, Virginia area a little bit, it's getting better now. Certainly you'd want to wear a mask more frequently, but when things get less intense, particularly when you're outside, you don't really need to wear a mask.
I want to talk about at the beginning of the pandemic, once again, the idea was to flatten the curve. We heard that over and over again, shutting down businesses, telling people not to congregate in large groups to flatten the curve, quote unquote. After all this time, do you think that was successful?
I think it was, so long as when you do that to give you time to put things in place that would actually alleviate the outbreak, such as getting people vaccinated, making sure you provide good ventilation indoors, making sure people understand that an indoor congregate setting, they should be wearing masks. To just say shut down for no reason without there being an end game to try and prepare you, then that doesn't make a lot of sense. We were always saying at the time that Dr. Deborah Birx and I asked the president to shut down things for at first 15 days and then an extra 30 days, it was to give us the time to prepare better because our hospitals were being overrun with patients. That was the reason to do that. It wasn't just an arbitrary decision to say doing that. There was a purpose behind it.
So all this time, you look back, you think the curve was flattened due to the
I
many different things that
absolutely.
society had to change and evolve in that period of time that was very difficult. You look back and you say that the curve was flattened.
Well, not only that, lives were saved because of that, Nick. Lives were saved. That's the point that gets missed sometime in the arguments.
I want to touch on monkeypox real quick. Do we have time to touch on monkeypox?
Sure,
Do we have?
sure.
Okay. Because school is starting, colleges are starting. We know that this is not, by definition, an STD, but it is spread in a similar way. So when the colleges start, people are congregating. There are gatherings in colleges and things like that. What do you think? What do you see as you see the monkeypox outbreak spreading? Do you see this becoming an STD similar to herpes or other STDs that we often hear about? That seems to be the concern right now, correct? How do you see this playing out?
Well, it doesn't have to be that way, Nick, if we do things correctly. This is a virus that's spread by close skin to skin contact and to a lesser extent by exposure to contaminated inanimate objects like clothings and blankets and things like that. I think in general, the manner in which it's spread should not be a threat to the general population. If you look at the demography and the spread now, it is well over 95% in men who have sex with men, where you have in the sexual networking context, you have the exposure to people skin to skin, usually in a sexual setting, but not necessarily so. The difference between this and other situations we've been in is that we do have good diagnostic tests, we have good vaccines, and we have therapy. So the real challenge is to implement those and make them available, particularly to the people who are at risk. If we do that correctly and expeditiously, we should get this under control.
Is
And
that
for that,
happening? Are we
yeah, I
doing that?
believe, yeah, we are. I mean, early on, it was a little bit of a slow start because the demand for vaccines clearly outweighed the supply and accessibility. But now, particularly with the ability to have vaccines available in much larger amounts, that is much, much more improved than it was just a month or so ago.
Okay, Dr. Fauci, you're going to play a role in your successor at some point being chosen, I suppose. You're going to probably be relied upon to steer in a certain direction. Is that correct?
Well, my successor will be picked by a national search throughout the country. I mean, obviously, people will ask me for my opinion, but I'm not the decider in that. The decider would be the director of the NIH.
Any qualities in particular you want to just touch on to tell the people exactly what you're looking for or what you would prefer in a person who would be taking over your role?
Well, there's a lot of talent out there, Nick. I just want someone who has a commitment and a burning passion and desire for public health in the arena of infectious and immune-mediated diseases. who has experience, who knows how to deal with people, and who has a good scientific background. Those are the things you look at for someone who you want in a leadership position, such as I am in.
All right, Dr. Fauci, thank you so much for your time. Really appreciate it.
My pleasure, Nick. Good to be with you.